in the United States. The use of illegally made fentanyl is driving a national health crisis as people use it unintentionally and die from overdoses. Fentanyl is now involved in more deaths of people under age 50 than any other cause in the country, including even heart disease, cancer, suicide, homicide, or any other accident. Fentanyl is intentionally used together with methamphetamine and other stimulants, commonly called a speedball. In the past, a speedball was mixing cocaine and heroin. Today, fentanyl is vastly cheaper than heroin, and meth is even more inexpensive. Extremely powerful and potent. But many deaths from fentanyl are because people don't know they're taking it. Fentanyl can be laced into any other street drug or pressed into a pill that looks just like another drug. Someone can think they are taking a pill like Adderall, Xanax, MDMA, ecstasy, or anything else, and it can actually be fentanyl. And just one dose can kill you, even if you don't use non-prescribed or illicit drugs. The vast scope of the crisis means you likely know someone who is affected by it. We all need to be aware every day of the risks associated with fentanyl, and what can be done to prevent overdoses, as well as how to recognize and reverse them. What is fentanyl? Fentanyl is a synthetic opioid made in labs. It can be up to 50 times stronger than heroin. Fentanyl is a medication that is prescribed by doctors, but most of the fentanyl that is used is made illegally in labs and mixed into counterfeit and illicit drugs bought on the street. Even small doses of fentanyl can be fatal. Just 2 milligrams, the size of 2 grains of sand, can be enough to kill someone. Fentanyl acts very quickly. People can stop breathing in as little as 5 minutes. What is the scope of the fentanyl crisis? Overdose deaths in America are at an all-time high. Over 106,000 people died from overdoses in 2021, according to a study of data from the U.S. Centers for Disease Control and Prevention. The same study found that deaths from methamphetamine increased 50-fold between 1999 and 2021. Nearly 2/3 of fatal meth overdoses involve heroin or fentanyl. Legal authorities have made record-breaking, but the drugs are still widely available and cheap. Upwards of 60% of confiscated illegal drugs are contaminated with lethal doses of fentanyl. Mixing methamphetamine and opioids isn't a new phenomenon, said lead researcher Rachel Hoopsick, an assistant professor of epidemiology at the University of Illinois at Urbana-Champaign. Although there has been an increase in the popularity of using these types of substances together, what has truly changed is the toxicity of the unregulated street drug supply, predominantly of fentanyl and other synthetic opioids. I believe that this is the primary driver of the increase in deaths. It isn't just the combination of the two drugs that leads to fatal overdoses. It can be difficult to recognize the signs of an overdose and be able to help reverse it in time. What are the signs of a meth and fentanyl overdose? When someone is using methamphetamine, it masks the effects of the opioid they're mixing it with.